Over the next half an hour or so, I'm going to be telling you what we are going to be doing at our clinic, Redefining Health at Rafael Medicare Center, Goa, India. To introduce myself, I am Dr. Lenny DaCosta, a consultant geriatrician, anti-aging specialist and preventive cardiologist. What is geriatrics? Geriatrics is a branch of medicine that deals with the problems of the elderly, of the people who are above the age group of 55 onwards. Preventive cardiology deals with stopping you from going under the surgeon's knife for a bypass surgery or undergoing an angioplasty. And anti-aging medicine simply gives you quality of life in the years that you have to live beyond the age of 60. Life today has reached a level that we live to be 90, but what is the quality that we live with? Beyond the age of 40, we are on 100 pills probably, giving us no relief absolutely. Having said this, I'd like to tell you how I got into geriatrics. In very early stages of my career as a general practitioner, I started getting a lot of patients over the age of 55 who used to come to me with plain hypertension. We started them on one pill. Over the next 1 year, we had to start with a second one. And then by the third year, they were on 4 pills. 5 years down my practice, I realized that all I was doing was giving them pills that had absolutely no effect on their disorder. It was just controlling the pressure for some time and then did nothing more for them. This led me to believe that there was something wrong that we as doctors were doing. So I decided to get back to college. I went for my geriatrics course, post-graduation in Bangalore at the MS Ramaiah College. And the first thing that stunned me was the first line on our textbook. Modern medicine has absolutely no effect or no answers for the degenerative disorders of the elderly. Having said this, I started understanding what we could do. And then I came to the understanding of how modern medicine worked over the last 1 century or so. See, modern medicine became very, very famous and accepted because we could take care of infections. We could take care of infections giving you a pill. In 5 days, your infection was over. We decided to use the same technique to treat modern degenerative disorders. Now, what are these degenerative disorders? See, as you age, your machine, that is the body, starts aging also. It develops its creaks and it cannot work as it used to earlier. With this comes a lot of problems. And if we decide to sort it out with tablets, without understanding the root cause of this aging disorders, we land nowhere. That has been the root cause of failure of modern medicine in treating disorders like diabetes, heart disease, hypercholesterolemia, that is increased cholesterol, and most importantly, hypertension. Today, you have a 25-year-old, a 35-year-old coming to us with diabetes and hypertension. That means early aging. What is your quality of life if you've got hypertension at the age of 35? You're going to be taking pills for a good 60 years of your life because you're going to be living to the age of 85 or 90. Now, would you like that quality of life? What happens if you're a diabetic at 40? You're going to be taking medications all your life with a rotten quality of life because you can't eat this and you can't eat that. That's your doctor's current advice to you. So having said this, what do we do to help you live better? What do we do to prevent disease and enrich your life? I'd like to give you a few things. My first question would be, what would you like to see yourself in? Maybe 40 years or 50 years of age. Would you like to see yourself in a wheelchair with scarce recollection of your past? Or would you like to see yourself walking, talking, energetic and happy? Do you want to just extend your life? Or do you want to be productive and live a productive, happy and disease-free life by just allowing your body to do what it does best, keep you healthy. Over the last 2 decades, medicine has proved that applied correctly, a new form of medicine known as anti-aging medicine or restorative medicine resolves 90% of your symptoms such as fatigue, insomnia, decreased libido, weight gain, anxiety, depression, and many more problems. And it also results in decrease in untreatable conditions like fibromyalgia and rheumatoid arthritis. Also, it helps in high blood pressure, IHD, PMS, that is premenstrual syndrome, attention deficit disorders, and sleep disorders. So, is this kind of medicine for you? Today, medicine has shown and data has shown that anti-aging medicine or principles of anti-aging medicine, if used correctly, can take care of your degenerative disorders. They can help you live with it better. You can live a quality life doing what you want, even up to the age of 80 if you follow these principles. Please remember, when you retire, you have the best years of your life ahead of you. You have slogged all your life to take care of your family, of your career, and now you have all the money in the world, but you have no health. This is what we strive to give you: better quality of life by preventing disease and enriching your life. So let's get rid of your current standard, which simply says if you take a pill, your pressure will go away. Wrong. Today, they do a bypass for your heart attack. Again wrong, because once the bypass is complete, and even if you have cancer, the cancer is removed, you are still left with the underlying imbalances which allow that plaque that caused the heart attack in the first place to come back and the cancer to develop once again. So given a choice, would you choose to restore optimal function and prevent these recurrences in the future? Would you again like to walk or live your life walking, talking, strong and energetic? Or would you like to live it in a wheelchair not knowing what your name is? So to live, you need to restore the balance. And this simply means optimizing the ability of our cells to do what they do best: keep us healthy, happy, keep those cancer cells at bay, and repair those arteries that are damaged daily. My dear friends, all this is done by your body. It is not done by your doctor. It's not done by your medicines. So what does this involve? How do you get your body to repair yourself? First, you need to correct your hormones. Second, you need to ensure a good, proper supply of nutrition to your body. Third, you need to remove all the toxins that exist in your body, especially the heavy metals. You need to maintain mental peace. And fifth, and the final one, is to maintain a body which is free from pain and is structurally sound. Remember, any disease is a manifestation of the imbalances in these 5 areas rather than just one cause. Let us understand weight gain. All of us complain of weight gain. It is a result of imbalances in the hormones: insulin, thyroid, cortisol, estrogen, and progesterone, nutrients that activate fat breakdown and muscle development, toxicities like metals, and acidity preventing the release of fat, and stress in mind causing increased cortisol and fat storage. So if you understand this, you need to get all these 5 areas corrected. You will stop gaining weight, and you don't need to starve yourself to become lean and athletic. Another example is brain fogging. As we grow older, we tend to forget small things, what we did yesterday, what we need to do tomorrow morning. We tend to forget where we have kept our spectacles, where we have kept our money. This is something that is common in everyone who reaches the age of 55, 60. This is known as cognitive decline. Let's understand cognitive decline. Again, it results from hormone deficiencies, from nutrient deficiencies, toxicities, and mind imbalances, especially stress. What about bone decline? The first thing your doctor tells you, you're 55 or you're 60, you need to take calcium. Nonsense. Bone decline is a cause of deficiencies of hormones, of nutrients, not just calcium, but calcium, magnesium, vitamin D, and boron, toxic overloads such as acidity and heavy metals, and most importantly, bowel toxins that prevent the absorption of all the nutrients that you normally take. What about hypertension? Again, it's toxicities, hormones, lack of exercise, lack of mental peace, stress. So whether we aim to cure or prevent a symptom or a disease, the basic 5 areas need to be addressed. Establish a healthy, enabling mind, correct deficiencies of hormones and nutrients, remove toxicities, and get the body pain-free and strong. By reestablishing this balance, we achieve optimal cellular function, so the cells of the body can do best what they do, keep us healthy. Now let's understand each of these 5 areas in a little more detail, and then you would know exactly what we do at our clinic. See, we age because our hormones decline, not the other way around. In women and men, hormone imbalances occur from the age of 30 onwards. That means you start aging from 30 onwards. By the age of 50, we are approximately 50% of hormone function for estrogen, progesterone, testosterone, thyroid, DHEA, melatonin, and growth hormone. This is 80% of the hormones that control everything that you do. So you have only got 50% of it by the time you reach your age of 50. So the next 30 years, you're going to have a lot of problems because you live to be 80. Medicine has ensured that your length of life is around 80 years. So what are the tips? How do we go about doing this job of restoring hormones? See, we use hormones that were given to you which are natural, not chemicals that are available over the counter in your local drugstore or pharmacy. These are natural hormones that are exactly identical to the way the body makes its hormones. So when you give it to the body, it recognizes it as its own. Hormone replacement has to be accompanied by nutrients, and we'll come to that later, because every nutrient activates the hormone receptors and also removes toxins, which may interfere with the hormone function. Always remember that we look at the function of your hormone because it is more important than just the hormone level. So even though your thyroid hormone may be measured normally, you may not have an optimal thyroid function. Therefore, when we assess you, we check whether your hormones are optimally functioning. To achieve optimal function of hormones, it is necessary to make sure that all your hormones are balanced, not just one. And when it comes to cortisol or high insulin, there are no magic pills, but we work with you to ensure that you have optimal levels. Why do we need to restore nutrients? It's very simple. With development, we have lost whatever nutrients our soil gives us due to leaching. And if we don't get these nutrients, then we do not get the energy that is required to break down the fat and build muscle. We need vitamins and minerals to proceed. Every cell produces damaging free radicals. This requires antioxidants to neutralize them, and all this comes from good nutrition. Every hormone requires minerals. thyroid hormone needs zinc, selenium, and iodine. So does insulin. So if you just take insulin without the proper levels of chromium, vanadium, magnesium, and vitamin B3, it will not act. Therefore, many a times as diabetics, you keep taking insulin and you have no result. You have absolutely no result when you increase your insulin levels. Now let's come to removing toxins. What are these toxins that we're talking of? My dear friends, the air that you breathe, the food that you eat, and the water that you drink are full of metals. Well, this is astonishing and shocking, but let me tell you, the air is full of lead and cadmium. Because lead comes from your petroleum products, cadmium comes from your radial tires. As they wear out, the dust of cadmium is in the air. Today, if young adults of the age group of 35 to 40 get diabetes, it's because of this cadmium. The food that you eat is full of pesticides and inorganic fertilizers. In both you have cadmium, mercury, and arsenic. In the water that you drink, you have mercury and arsenic. How would you have water which is with this kind of heavy metals? A simple thing. Today we use CFL lamps, we do not know how to get rid of them. Or a thermometer, we don't know how to get rid of it. We just throw it in the waste paper bin. Remember, they contain mercury. Mercury is an element. It does not get destroyed. So it goes into your groundwater and you drink it. Now what happens is normally you do not have levels of these metals that poison you, but they are elevated much higher than safe levels. None of these metals have safe levels in your body. It's already proved that whatever safe level that modern medicine thought was enough in your body is no longer safe, because you still get problems even well below that. So these metals have no place in your body. You need to get rid of it. It is because of these metals in your body that you get hypertension, you get high blood pressure, that is hypertension, you get high blood sugar, that is diabetes, and it is because of these metals that you start getting heart disease. And if your cholesterol goes up, it's not because you're eating fat, it's because your body needs to repair itself because of these metals attacking you within. It's the oxidation process that results with these metals being in your body that gives rise to the first plaque formation within your arteries that finally leads to heart disease and heart attack. So if you need to get all these areas or all these diseases under control, you need to get the metals out. I must tell you that I have treated over 8,000 plus patients who have had ischemic heart disease. 30 to 40% of them have had already a bypass or an angioplasty done and still have problems. All of them are today much better with what we do, removing these metals with a therapy known as chelation therapy. I have used this effectively for people with diabetes, for people with cardiovascular problems, that is your heart attacks, people who have had heart attacks, people who get angina, people who are told to do a bypass surgery. I have used it effectively with people with diabetes, with diabetic feet, where they were told to get their foot cut because of lack of circulation. I have used it effectively with people with cerebral vascular problems, that is, people who cannot use their brain properly, or they have had a stroke, or they have dementia, or Parkinson's, or even early stages of Alzheimer's. So you need to use this along with providing proper nutrition to get rid of all these conditions. We at our clinic use it on a regular basis. This is one of the treatments that we do. The other way of getting rid of toxins is ensuring that you sweat it out. We use the far infrared saunas to help you remove as much of toxins that are in your fat cells as possible. Because remember, all the toxins that enter your body get into your fat cells. Therefore, when you start getting these toxins in your body and your body can't handle them, you start putting on weight. For a gentleman, the first sign is when he starts getting a paunch. For a lady, it's when she starts putting on weight and she can't reduce it even after all the aerobics that her physical trainer tells her to do. So you need to remove your toxins. The two ways that we do it at our clinic is chelation and far infrared sauna. We also use ozone therapy, which is widely used today to cleanse your blood. And in cleansing your blood, you can get rid of many of the allergies that you may have, many of the skin problems that you may have, and even chronic infections that give rise to further degeneration within your body. Then we ensure that most of our patients are in a position to balance their mind and the body. We teach them how to handle their stress. We teach them meditation. We show you that you can use yoga, tai chi, and many other breathing exercises to control the stress. And we show you how just controlling your stress can reduce and reverse a lot of the degeneration and control your blood pressure and your heart problems. And finally, we also show you how to maintain a strong and a fit body by teaching you how to exercise regularly and what aerobic and anaerobic exercises you should be doing. But when you do your exercise, we ensure on discipline, because the key word here is discipline. So whether it rains or shines, or it is cold or hot, some exercise, either indoors or outdoors, has to be performed. Now, having said all this, what happens when you still do not respond to any of our therapies? Well, a small percentage does not, and for them, we have other alternate methods. We use stem cells to treat you. What are stem cells? Stem cells are building blocks of your body. They are the ones that built your body when you were in your mother's womb. These are the stem cells that created each and every organ in your body. We use those very stem cells to regenerate those areas of your body which have got destroyed, either due to the toxins in your body or simply because of age. Because remember, as you age, you are exposed to all the ravages that life can offer you. So stem cells is another area that we give you. It does help to bring down your diabetes and control it to a large extent, preventing you from having to take large doses of insulin. We also give it for osteoarthritis that will prevent the pain and definitely stop you from undergoing a surgery to replace your knee joints. We give it for general wellness. We give it for stroke patients with excellent results. And we also use it in Parkinson's and Alzheimer's. So this is another area which is cutting edge that we have in our clinic. Besides this, we also have special packages for just rejuvenation. We have special packages for cardiac patients. We have special packages for Parkinson's. And most importantly, we tell every patient who is of the age group of 40 to 50, if you have had high blood pressure or you're diagnosed with high blood pressure in the last 3 to 5 years, or if you're diagnosed with diabetes in the last 3 to 5 years, please come over to our clinic. We will assess you. We have a complete array of tests that we do which assesses you completely. And then we will provide you with a protocol that will stop the progression of this chronic degeneration in your body and possibly reverse it, giving you a chance to live a quality life, a much longer life by preventing disease, thus enriching your life. If you need more information on any of these areas, kindly send us a mail to info@rafaelmedicare.com. and we will let you know how to go from there on. Thank you.